Mr. Cannon, can I come in?
Yes.
Hi, my name's Erica. I'm going to be the student midwife taking care of you today. We're just going to do an assessment of the hair, skin, and nails, eyes, ears, nose, and throat. Okay? If at any point anything is uncomfortable or painful, you just let me know and we can stop, okay?
Yes, ma'am.
Could you start by telling me your name and date of birth?
Cedric, June 30th, 93.
And what year is it?
2023.
And where are we at right now?
The doctor's office.
Okay, so my client is alert and oriented. His affect is appropriate for the situation, and he appears to be well coordinated. So moving on with the exam, I'm going to start by inspecting and palpating the hair on his head and face. His head shape appears to be normocephalic. There is equal hair distribution for the most part. Hair distribution in the beard looks good. I don't see any skin abnormalities, any bald spots, or any areas of concern there. So I'm going to inspect and palpate at the same time the hair on his extremities. We're going to compare both sides. Looks like the hair distribution on the upper extremities is also equal. And I'll look at your legs the best that I can see. I'll roll your jeans up. There's a fly on your forehead.
You want me to take them off?
No, it's okay. If I had concerns or the client had specific complaints, we would have him take his pants off. But for this video, we're not going to do that. Can you roll up this side as well for me, please? And I'll look at both sides. Inspecting and palpating. The hair distribution there is also equal. There's no obvious swelling or any signs of concern for the lower extremities either. While I'm down here, I can look at the nail growth, looking at his toenails. Everything appears to be well there. This side is also good. Cat refill, less than 3 seconds. And I'm gonna look at your fingernails up here while we're at it. I don't see any clubbing or unequal nail growth or concerns. You actually have nice fingernails. Thick, they're not brittle. Everything looks good there. Now I'm going to palpate the face and neck. If any of my touching is uncomfortable, you just let me know, okay?
Yep.
I don't feel any masses or bumps. I don't see any lesions. Everything there looks good. Next, we're going to start to palpate the lymph nodes. In front of the ear. And here we're making sure that we're checking the occipital, postauricular, posterior cervical, anterior cervical, submandibular, submental, parotid, preauricular, and subclavicular. Then we can palpate the trachea. It's not grossly enlarged. Any tenderness? No masses, nothing there. We can also palpate the thyroid here. I don't feel any goiter. Can you swallow? Good. Any difficulties, pain? Nothing with that. Swallow again for me. Good. There's no tracheal deviation. I don't see any obvious signs of respiratory distress or any airway obstruction that would be concerning there. While we're here at the neck, we can palpate the carotid artery one side at a time so we don't occlude the blood flow. Those are even. And then we can also palpate the temporal pulses while we're here. his temporal pulses are easily palpable.
Probably a little hot right now.
Then I'm going to use the bell of my stethoscope to listen to both carotid arteries and the temporal arteries for any bruits. We're going to compare both sides. And I don't hear any bruits there. So the next thing we're going to test is cranial nerve 6, the accessory nerve. I'm going to have you shrug your shoulders and turn your head against my hand. Good. This side. Good. Then for the eyes, I'm going to inspect and palpate any tenderness there. I don't see any swelling, no discolorations. I don't see any drainage from the eyes. There's no tender areas there. I think everything looks well there. And then the next thing that we can do is your visual acuity. So if you want to stand up, I'm going to move about 15 feet away and have him read this eye chart. If you want to cover one eye and just read from the top.
ELTFPHOLCFDHJBSEPTZOFF. That's the whole chart.
Okay, and could you do it with the other eye?
Oh, do it with the other eye.
Just read the last line with the other eye.
Okay. LTFPH. Pretty sure that's it.
It is. The next thing that we can check is the corneal light reflex. So I'm going to use my ophthalmoscope. I have to put it together. And I'm going to turn this light off above us. I'm going to turn the light on and make sure that my dial is set to 0. And then using my dominant eye to his eyes, that's how we're going to look at it. So for the corneal light reflex testing, we could look at something from 15 feet away. I'm going to shine the light at the midline for both eyes, and the light should be the same in both locations of the pupils. This evaluates for strabismus and symmetrical gaze. If we did not see the light reflex in both eyes at the same location, that could be like a retinal issue. So I'm going to start here. This way. Good. Now I'm going to use my eye to your eye. I can also use this light instead of the pen light just to check, look at my nose, pupil reactions. We want our pupils to be round, reactive to light and accommodation. Look. Good. Good. And when we're checking those pupil reactions, we want to check each eye twice, watching for a direct response. The other thing that we can do, I can use this tool as well, is the cardinal gaze. So we're going to start up here. I don't want you to move your head. I just want you to follow this with your eyes, okay? And with that technique, we're going in like an X point and then left to right. the next thing that we can do is take this off. We're gonna check the ears. Actually, the light's probably fine. I'm gonna start just by inspecting the outside of the ear and everything that I can see without the otoscope. I don't see any obstruction. His ears and earlobes are symmetrical on both sides. No redness. Any ear pain? Okay. Any drainage? No. So that's good. I'm going to palpate around just to make sure that no pain.
No.
No pain there?
Nope.
Okay. Then for the otoscope, I'm going to use my left hand for his left ear, my right hand for his right, and we can hold it upside down almost like a pen. I'm gonna just gently pull upwards and look. There is a big clump of earwax in there, so I really can't even get a good look at the tympanic membrane.
What would you like to get the earwax out?
You might have to see an ENT specialist for the amount of earwax that appears to be clogged in there. Same thing on this side. I'm going to hold it upside down using my pinky as a fulcrum to kind of keep the scope from jamming in his ear if he were to turn his head towards me. There's not as much earwax in here, and there is a clear tympanic membrane. There's no fluid, there's no redness, and he said it's not tender, so maybe he just needs to clean out one ear. I could also use this light to look up into the nasal cavity, make sure that it's patent, no obstructions, nosebleeds, anything like that. Nasal drainage. Are you able to tip your chin up? Good. There is a lot of hair in there. It's good actually, because the hair helps filter out the dirt and stuff, so that's good. There is pink nasal turbinates, no blockages. Are you able to hold one nostril and breathe out of one side? And have a good one. Okay, so both nares are patent. I don't see any abnormal drainage, no occlusions, nothing of concern there. So I can also, while we're here inspecting that, sorry, my back hurts. We're gonna palpate the sinuses. Are you okay?
Yeah.
Okay.
You don't want you touching on it.
No sinus drainage or pressure.
No.
I'm gonna look at your nose. It looks symmetrical from the top. The shape is proportionate, and everything looks good there. We can also test for TMJ, the mandibular joint. So I'm gonna press right in front of the tragus into this, and I want you to open your mouth and move it all around. Is there any pain while doing that?
I mean, it doesn't feel the greatest, but it doesn't hurt.
Well, I don't feel any swelling or anything, but if it's a little bit tender, then maybe it's something to reevaluate.
You're pushing gun over.
Oh my gosh, I wasn't pushing hard. The next thing we can do is inspect, ouch, I'm gonna use this light. Inspect the mouth and the pharynx. We can look into, sorry, my phone is dying. Okay. The mouth and pharynx, and make sure that there's no obstructions, swelling of the tonsils or anything like that. So I'm gonna have you open your mouth and say ah. There is, okay, that's good. indentation. I'm going to use the tongue depressor just to displace the tongue.
Come on. There you go.
Okay. I don't see any swelling of the tonsils, and there is a rise in the uvula. His teeth look appropriate. The other thing that we can check, again, is cranial nerves, the glossopharyngeal, the vagus nerve. That was also the gag reflex and say ah, so he was good with that. And the hypoglossal nerve. So if you could stick your tongue out, move it side to side, and you were able to say ah, and there is no difficulty swallowing in the previous exam. You can put your tongue back in your mouth. Thank you. And I think that covers our exam.
Alright, apologize for the laughter.
Thank you.